Hi, I'm Dr. Rajdeep More, consultant gastroenterologist, hepatologist and GI endoscopist at Gastrocure Endoscopy Center and Liver Care Clinic in Thane. Let us talk something about chronic pancreatitis. So pancreas, as you know, is an organ situated in the upper part of the abdomen. It consists of head, body and tail. It is responsible for digestion of proteins, fats and carbohydrates in your diet, as well as producing insulin. So now there are many conditions in which the pancreas may be damaged. The commonest ones being alcohol related damage to the pancreas. There can be the slippage of the gallstones from the gallbladder to the bile duct, and this can irritate the pancreas. There are some medicines like painkillers or anti-diabetic medicines which can cause inflammation of the pancreas. Autoimmune disorders, genetic and hereditary causes can be there for damage to the pancreas or pancreatitis, and smoking is also a risk factor for pancreatitis. When there are such repeated attacks of pancreatitis, there may be irreversible damage to the pancreas, and that is called as chronic pancreatitis. What are the symptoms of chronic pancreatitis? So the patient typically presents with severe abdominal pain in the upper part, which radiates to the back. There may be significant weight loss because of lack of absorption of proteins, fats and carbohydrates. There may be oily stools. The stools will be floating oily because the patient is not able to digest the fats and these are lost through your stools. And over a period of time the weight loss may worsen, the abdominal pain may worsen. Now how do you diagnose cases of chronic pancreatitis? So chronic pancreatitis is firstly diagnosed on imaging studies. So CT scans and MRI scans are very important. The CCT abdomen as well as a specialized MRI called as an MRCP. So that is magnetic resonance cholangiopancreatography. So that is a specialized MRI only for the pancreas and the bile duct. In that you can see that the size of the pancreas has reduced, the pancreatic duct is narrowed, and these are all the changes that you will see on imaging. So now what are the complications of chronic pancreatitis? So chronic pancreatitis over a period of time in about 5% of the cases may lead to pancreatic cancer. Hence it is very important to diagnose it early. How do you go ahead with treating pancreatitis or chronic pancreatitis? So management of pain is very important. Management of steatorrhea or oily stools is very important because that leads to a loss of your nutrients. So pancreatic supplements are available today. These are the mainstay of treatment or medical line of management, where we give pancreatic enzyme supplements which do the work of the lack of enzymes which are there in chronic pancreatitis and help to digest the food and help to gain weight. Now when there is a structural damage to the pancreatic duct, or if there are any strictures or stones in the pancreatic duct, they have to be removed by a procedure called as ERCP or endoscopic retrograde cholangiopancreatography, and a stenting needs to be done. That helps in relief of pain. It helps in treatment of your malabsorption or lack of absorption of the nutrients, and also in some cases it is found to help in treatment of the diabetes that occurs because of chronic pancreatitis. So in some patients they may require repeated ERCPs to remove the stones, remove the pancreatic stones that develop, and also to place a stent within the pancreatic duct to allow free flow of the juice and prevent the damage further. So whenever you are diagnosed with chronic pancreatitis, do visit your gastroenterologist and understand the entire spectrum of how to treat the chronic pancreatitis, as well as what are the precautions that you need to take. Regarding the prevention and the diet that needs to be followed, so it has to be a low fat diet. You have to space out your meals throughout the day rather than eating large meals at a single time, and regular pancreatic enzyme supplements during meals are the mainstay of therapy because that will help in relieving your symptoms. So do visit your doctor and gastroenterologist to further understand about chronic pancreatitis.